changed sort of how you guide a patient?
The advent of the
Challenges and students have.
the advent of the internet has changed the dynamic between patient and doctor quite dramatically. It used to be that the patients had very little information and basically just depended completely on what the doctor told them. Whether they gave them a lot of information or little information, they pretty much depended, and they trusted that I was being told the right thing and the most complete information, and that was that. Now there's a more of an interactive discussion with, for example, talking about what the standard of care is and what are the alternatives to standard of care. Patients, and particularly their family members, come armed with, well, I also read about this other therapy that is being looked at. What do you think about that? Should we incorporate that? And overall, I think that that's a healthy discussion because those are valid questions. And in terms of establishing trust with the patient and their caregivers, to have that kind of open dialogue and not be resentful or feel like it's personal in terms of why someone would question you. I think that having that kind of open discussion about why something would be used, why something probably should not be used, I think is overall healthy. And what that does is it gets them to realize that they respond to us. They're with us together. We're all forming this together. I think the best way to formulate a treatment plan is not as much of a dictatorship, which is I tell you what you're going to get, no questions asked. It's this is what I think is best for you. You tell me if that makes sense for you. If not, why? And I think that kind of information, it allows for those conversations more often, because otherwise they don't really have any questions. They just listen to what you say.